You know what the main obstacle is in these cases? Is the client or patient themselves, to be honest with you. You know, I've seen so many people in my life, I can't even tell you. And I can read you when you come in. I can tell you whether you're going to do the program, whether you're not going to do the program. I can see where your hang-ups are, where they're not. And it's like, you know, and I try, when I see them, I try to talk to them because I know exactly their consciousness and what they're going, how they're going to respond. And sure enough, and so I try to pre-warn them and try to get into them, because not everybody can shift like that. Sometimes it takes an awful lot of fear, and sometimes people have to go through chemo and go through that and get ravaged with that or radiation, and then understand that, whoops, there's nothing we can do, there never was anything we can do, and we just made your life a whole lot worse. Sorry, bye. That doesn't work. Now there are those have got some success out of that, there's no question. But when you're down to 3 to 6% success rate, and that's only those with strong constitutions that survive this, it's not the fact that there's any remedy with chemo or anything, it's the individual themselves that are the survivalists of that. It's pretty scary. And so the opposite's true. Probably only 6% of the people that try our way don't make it. But they're already been through the AMA and everything else. It's rare to have someone that didn't not make it. But the problem I see in our field is that there's so much crap out there, like the Budwick program. That makes tumors grow right off. There's so much crap out there that people waste their time before they're introduced to this higher level, and I'm hoping that we'll change all this. Chemotherapy is not going to just damage or kill damaged cells, it's going to damage all your cells, and that was the latest study done on chemo. I can't figure out why the oncologists aren't being raided and arrested right now. After that study, it showed that chemotherapy damages healthy cells to the extent of causing more cancer, and yet we are continuing to allow chemotherapy to be used. These guys ought to be arrested and put in jail right now. Anybody that uses chemo. And I was talking to a dialysis patient, and I forgot to tell him, and this is Ali, hi Ali, tell him about the dialysis drugs that are now on the list of bad drugs, these chemo dialysis drugs. Is it any wonder it's hard for you guys that are on dialysis to get yourself off of there? Because the chemicals that they're giving you is damaging your kidneys further on top of it. I mean, it's an insanity that's got to be stopped. You just got to stop it. Or mankind doesn't exist, so it's just got to be stopped. You know, we got to raise our level of consciousness and join at a higher level of healing each other. Or whenever your food is hot and you can't eat it, do you add more heat to it so you can eat it? You don't, do you? You want to cool it down a little bit, right? When something's acidic, you don't add more acids to it. So where does this idea of chemotherapy? That's a crime to me. That isn't a bad idea. That's a crime to me, because it flies in the face of what we know about chemistry, and it's a killing machine. So medical doctors are giving chemo to psoriasis patients. I had a young girl, she was 19 or something in here for something, maybe even the psoriasis, and she says, oh, I'm on chemo for it. I said, you're what? See, these people need to go to jail. And that way you can sit down, have some time to yourself, and think things over, and maybe learn meditation, and learn what you don't do. Maybe take some classes. Maybe we could go into some prisons and teach some classes on what you don't do to others. We all know, everybody knows radiation causes cancer. How come these guys aren't arrested right now and taken to jail? Makes me sick to my stomach. These guys are allowed to get away with it. I'll tell you this. It only appears that way because karma is going to come bite them. When you start giving acids at the level of chemo, that's a crime to me. This idea, oh, we're doing this to try to help mankind to survive, that's all bullshit. You know, this is a crime to do these things that causes the destruction of tissue. When you destroy tissue in someone, you're setting them up for death. Destruction of tissue is not how you get someone well. Chemo and radiation literally destroy cells. So where do those cells that they destroyed in your chest wall, where are they gone? And it can't be through your lymph system because your lymph system isn't working right. It's backed up. That's why you have the tumor. They have the audacity to say if you do chemo, you can live a few months longer. Are you kidding me? That's not even factual. That's not even statistical. The statistics show the other way. If you do nothing, you'll live longer. It's a money-making organization. The only way to heal acids is to take a hotter acid. Now, if you believe what I just said, you just bought into allopathic thinking. When you have high acidosis, we're going to give you a hotter acid. That's not what you do. Whenever you have acidosis, you have to go to the other side of the chemistry, which is the neutralizer, to acids. Just like acid neutralizes alkalis, alkalis neutralizes acids. You know, I took IV therapy at Botech down here because I had to have it in my work at the hospital. And I wanted to know advanced life support and higher cardiac. There's national boards you can take in cardiac work that I wanted to pass and stuff, and so I had to have IV therapy and all that. So when I took IV therapy, the nurse practitioner, and we were practicing inserting needles and everything, of course, and the nurse practitioner then got to chemo. And she said, you have to wear these gloves. And she said, and that's when they were doing more IV therapy, chemo through the artery in your hand, or the brachial in there, in your arm, or the subclavian, but it was more in your hand here. And she said that don't spill chemo on the skin. Be very, very careful. And I said, how come? She said, well, it'll burn a hole in the skin. I said, okay, now, so what's the skin made of? She said, cells. I said, okay, so you want to inject this substance, this highly acidic substance, which I didn't tell her at the time the pH because I didn't figure she even would understand that. Because I already knew the pH of chemo back then. And I said, so you want to introduce a cell killer acid into the venous system. I said, what's your vascular walls made up, honey? She said, cells. I said, so you don't want to spill any on your skin because it burns a hole in your skin, but it's okay to inject it up a vascular wall, which is your main nutritive line, feed to all the cells. You want me to inject this high acid that'll burn a hole and it'll destroy the cells right on your skin if you spill it, but it's okay to inject it in your mouth? How many people have I seen walk in here that had a collapsed artery all the way down their arm? Or vein, all the way down their arm. So does that make sense? I'm sitting there looking at this nurse practitioner going, are you serious? Of course, I already knew all that. But just to impress upon her the seriousness of what she's thinking and what she's talking about and what she's instructing her nurses to do. Insane. Insane. This is why good nurses quit and belong to the Holistic Nursing Association, go to more home care type things and get away from this insanity that the medical profession in hospitals and cancer clinics can do to you. The suffering of those after chemo and radiation and the burns and then the more aggressive cancers because it's just more aggressive burn to cells, then you see more aggressive symptoms. Now that your cancer's moving, they need to take that cancer and shove it up their heinies because they put a wrong word on it, so it gives people an understanding that it could be a disease coming in and afflicting them, and oh my God, how do you battle this horrendous thing? I wish it was that easy. And you don't have to submit to chemotherapy and radiation that causes cancer. When are we going to start prosecuting those people that do cancer-causing therapies on you? You know, it's enough to damage your cells, but to do therapies that continue or damage your cells deeper, this is a really sick and dark aging. So, you know, it's sad when the children are involved. You know, we have so many children we're dealing with right now with the cancers. It's just sad stuff.